I
Cool.
have Dr. Peter Kozlowski in the house to talk about gut health. Am I right?
Gut health, and actually, my new book is on toxins, so we can go in any direction. We could talk about toxins. We could talk about hormones.
Love it.
Um, the book I published last year was on gut health and the microbiome. This one that's about to come out is half about hormones and half about toxins like heavy metals and
Okay.
mold and the connection between the toxins and the hormones.
Heavy metals and mold. Well, let me ask you this. What is the most common toxin?
Those two are the
Those
top
two.
two.
And
Especially
mold,
for you in Florida, you got
yeah,
you got a lot of mold going on down there.
a lot of mold going on. But does that get in my food? And how can I prevent myself from getting mold in my body?
It gets in your home when there's water damage and you breathe it in, and it completely can screw up your body, causing rheumatoid arthritis, fatigue, gut issues, blood pressure issues, dizziness, autoimmune disease. And it's mostly from people breathing it in. There's a
Got
little
it.
bit in food, but the food mold doesn't really affect you.
Okay, well let's talk about mold for a little bit. And just to put this in layman terms as simple as possible, let's pretend that I'm in a house that has mold in it because obviously there's a lot of moisture in the air and I'm breathing it in and these chemicals or these subatomic particles, whatever it is that makes up the mold is getting into my respiratory system. Is that correct?
It gets everywhere. It gets into
It
your
gets
brain.
everywhere.
It gets into your testes, into your hormones, into your thyroid. Yeah, it's one of the it can cause low testosterone. So it I could definitely just explain mold and probably some misconceptions that people have it, especially from their regular doctors.
Why don't you do that? But I want to
Sure.
challenge you to explain it as
Yeah,
simple as possible.
that's my specialty.
Let's hear it, my man. Looking forward to it.
Cool. We already recording, or are we?
We're live. We're ready to go.
Okay, cool.
Yeah, if that's cool with you.
Yeah, yeah, yeah.
So we're learning a little bit about toxins today, and we're starting off on the conversation with mold. It gets in our house, it gets in our testes, it gets in our blood, it gets in our respiratory system. Now, first question for you actually:
Yeah.
is there a way to test for mold? Like, can I go to the doctor and get a blood test, or do a VO2 max test and find out if I have mold in my body?
Not your regular doctor, but if you have a functional medicine doctor, then yes, absolutely, we do testing. Um, so, mold toxicity is one of the most common things that I work with. And I am a traditionally trained family practice medical doctor that kind of converted over to the dark side and went to functional medicine. There is a branch of functional medicine called environmental medicine. So that's kind of what we're getting into. But the reason someone would see a functional medicine doctor like me is because they've been diagnosed with rheumatoid arthritis or Hashimoto's, or they have chronic fatigue, like someone I saw this morning. And they're going to their doctor, like the girl I saw this morning. She's been to a GI doctor, she's been to a rheumatologist, an endocrinologist. Everybody's telling her she's fine. She has swollen lymph nodes all over her body, and her gut is a mess. And her house has this long history of water damage. And so for me, when I see somebody's system going haywire like that, where their immune system's screwed up, where they're reacting to foods, they're getting hormonal issues, they have fatigue. The reason you come to me is to try to figure out why, right? And so anybody who's living in a house that has a history of water damage, the first thing I'm going to talk about when I see the immune system or the hormones going haywire is mold. And
Yeah.
there's a lot of things that are difficult about mold. The first one is that your regular doctor doesn't really accept it, right? So if you go to your doctor and you're like, "Hey, I think I have a mold problem," they're going to test you for an allergy to mold. That's not at all what we're talking about. We're talking about a toxicity from mold. And so the difference is the type of immune response. And an allergy is like you walk into a moldy house, your nose starts running, your throat might get dry, etc., like a regular allergy. A
Mhm.
toxicity is when you're accumulating these mycotoxins, and I'll explain what those are over time. And that could be 3 months, that could be 30 years before it sets off
Mhm.
disease. So when mold grows, it releases kind of two main things. It releases spores, and spores is how mold replicates. spores are what cause a mold allergy. So that's what your doctor is going to test you for. But
Got it.
the other thing that mold does is release mycotoxins. Mycotoxins are the defense mechanism of mold. The mycotoxins kill everything around the mold so the mold can grow and thrive. Well, those mycotoxins get into our bodies. We breathe them in, they can get in through our skin, through our gut, and then once they're in our body, they can go everywhere. One of the favorite places for toxins to go is your thyroid or your testes or your adrenal glands. They love to damage hormone systems. They love to attack
Got
your
it.
immune system. And they're floating
Okay.
around, and you'll go to your doctor and they're like, all right, well, you tested positive for rheumatoid arthritis. We have no clue why, but here, take this drug to suppress the symptoms. And then once this drug stops working, then we'll try this other one, and then we'll try this next one. And by the way, here's a list of 50 side effects of it. The whole time you're still living in the mold, right? And an extremely difficult thing is there's so many, but in my experience, 99% of people that I've worked with, only one person in the house is sick. So, that a lot of times a spouse or a father or daughter, or whatever, will be like, it can't be mold because everybody else in the house is fine. 99%
Mhm.
of the time, that's what I see, that it's only one person has symptoms.
Okay, let me ask you this. Let's say I'm in a household where I'm breathing mold
Mhm.
and I haven't seen any symptoms yet. It hasn't really affected me yet. But I want to make sure that, God forbid, I am in a house with mold. I am preventing my situation from getting worse. So what can I do? Should I be fasting? Should I be drinking twice as much water? Is there a superfood that prevents mold in my body?
If you're breathing it in, there's really no way to prevent it. What you can do is try to minimize it. So I didn't even answer your first question, which is urine mycotoxin testing. So the first thing I would do is order a test for mycotoxins. So I explained the difference between spores and mycotoxins are the defense mechanism. So a mycotoxin test is a urine sample, and we measure the
Okay.
excretion of mycotoxins. You should not be excreting any. If you are, then we have a problem. Now, in regards
Okay.
to, I frequently will tell people to move. And there's some controversy around that about whether or not remediation works. One of the problems you'll run into is that if you call your local mold inspector, they will only test your house for spores. Mycotoxins are a lot smaller, so your house can test negative for spores, but it still has mycotoxins in it. So typically, what
Okay.
I'll do is test somebody's body. If their body comes back positive, then we'll test their house. And then we try to stop exposure. And once we stop exposure, the best thing that you could actually do to get rid of mold, infrared sauna. So there's two parts. That one is the best way that we detox is through urine, poop, and sweat. That's how we get toxins out. Because toxins, whether we're talking about mold or heavy metals or whatever, they're fat soluble. So that means when we breathe them, eat them, drink them, we will store them. Luckily, the way our bodies are designed is that the first place the blood flow goes is the liver. And the liver is your main detox organ. And it goes through this two-phase process called detox, which makes toxins water soluble, which means then you can pee them, poop them, and sweat them out. So you got to be drinking lots of water. You've got to get your gut right to make sure you're moving your bowels every day. And exercise is usually not enough. Like my wife, I detoxed her from mold. She was doing exercise followed by sauna every day. And it took 9 months to get the mold out. So
Is there a difference between infrared sauna and a dry sauna?
the infrared rays kill some of the mycotoxins or counteract some of the mycotoxins. So, really, when you're talking about mold detox, I really, really prefer the infrared because you're getting a two-part effect. The rays, the infrared rays, are killing off the mold, and then you're sweating it out. So,
Got it.
I would
Okay.
really go with the infrared for detox.
That makes sense. Let me ask you this question. When it comes to heavy metals and toxins in general, not just specifically to mold, what are some of the foods that people should be avoiding? Are there any misconceptions to a diet here and nutrition?
I would say fish is a big one. The highest levels I've seen in mercury are in people that are eating sushi 3 times a week or more. So the problem, any kind of like canned foods, the problem is your drinking water will frequently have lead in it, especially if you live in a city that has older pipes. They did a study in 2020, I believe, or maybe 19. They found, I think, 400 times the amount of mercury in organic Gerber baby food than should be in there. And that's something that's organic and in 2020. So you imagine what that was like
Yeah.
10, 20, 30 years ago. It's
Yeah.
the problem is mercury gets into our air, lead can get in our air, and then what happens?
Yeah.
They settle, they fall down, and where do they land? In our soil. What's growing in our soil? Our crops. And so we're absorbing that stuff through vegetables, fruit. An even crazier thing that I learned is I find a lot of elevations of cesium and thallium in people when I do heavy metal testing. So those are two toxic metals that are used in the agriculture, or excuse me, in the oil industry. So they're two
Yeah.
chemicals that they use for oil production.
So unfortunately, there's only oh, sorry to cut you off, but unfortunately, there's only so much we could do. I mean, to the average person listening, you're giving such good information, right? But they're not, if it's in the air, it's in the air. If it's in fish, it's in fish. But let me ask you this: what about canned sardines? What's your thoughts on canned sardines?
Sardines,
Good
to
or
my
bad?
knowledge, I don't think are an issue when it comes to heavy metals. So
Okay,
I,
because I eat a ton of canned sardines. So
I don't think you have to worry. Um,
okay,
but at the same time, I think, to me, true preventative medicine. So people should not be
mm,
coming to me once they've been diagnosed with lupus or Hashimoto's or dementia. People should be coming to me when they're like you, when you're healthy, when you're doing what you can. And we're just, it's not our fault. You could be trying to live the healthiest lifestyle, but what they've done to our environment is making people sick. And so, I would start testing people for heavy metals at the age of like 2 or 3. And I think that would be, and for mold, if there's an exposure history, but I think that's
yeah,
true preventative medicine. So they are all of these toxins that we work with, we can get them out of your body. The problem is that most people don't know they have them till it's too late. So I think that getting with a functional medicine doctor that can test you for heavy metals, that can
yeah.
test you for mold, can test you for glyphosate, herbicides, plastics, parabens, all this stuff, getting that testing done, once a year, once every few years can really be preventative for a lot of these crazy conditions that people are getting diagnosed with
Right.
more and more.
You're absolutely right. Preventative medicine is so much more important than being reactive to something we already have. So let's not drink 36 grams of sugar in a can of soda. Let's not smoke a pack of cigarettes a day. And let's prevent cancer and prevent a lot of these things that are going to kill off our mitochondria, make us lazy, make us fat, pre diabetic, low energy levels, brain fog, all about that. Let's say I came to you.
Yeah.
I said, Dr. Kozlowski, I want to do the heavy metals test, mold test, gut microbiome test, every single test that you mentioned.
Yeah.
How much would that cost?
For all of them, I think you'd be around $1,200.
That's not bad.
That's
That's not bad.
when I was writing my book, and because traditional doctors don't do heavy metal testing, they don't do chelation therapy, which is what I do. And I was trying to figure out why. So, one of the things that's written from the traditional medicine standpoint is the cost. They're like, the cost is crazy of heavy metal detox. The cost of a heavy metal test is $150. The cost of a chelation plan, even if it takes you a year, is probably $1,000. They just got approved
Okay.
last year a new Alzheimer's drug that they were going to charge $58,000 a year for. So I like almost fell out of my chair laughing when, I know it's not cheap up front, but I always kind of say functional medicine is the absolute worst business model because people will spend money on the first day. I don't work with my patients past 3 months, 6 months. Like, I don't have return clients. Traditional medicine is like, let's get you hooked on Lunchables
Yep.
and fake
Uh-huh.
food, get you diabetes, get you on meds, and then we're going to keep you
So
alive
you
as
come
long as
back for life.
possible.
Come back for life. It's
Yes,
a
it
business.
is.
It's bullshit.
Yeah.
That's why we cannot trust everybody and we need to make decisions for ourselves.
Yeah.
So, I want to kind of pivot the conversation to microbiome and
Yeah.
gut health. This is something that obviously is super popular, and you can do gut microbiome tests
Yep.
online for $100. But when we're doing these
Yep.
tests, and I'm about to actually do
Uh-huh.
one myself,
Uh-huh.
when we do those tests, what are we looking for? Like, what are we trying to figure out here when it comes to our gut health?
So all of us have 3 to 5 pounds of bacteria growing inside of us. I have this,
Good bacteria.
it depends. We don't know. That's the point of
Got
a
it.
stool
Okay.
test. So we all have these probiotics, or is the generic term when they're considered good. So yeah, we should all have probiotics. And the way we get probiotics is during a vaginal birth. When you're born as an infant, when you pass through the vaginal canal, you pick up probiotics. The next way you start getting probiotics is through breast milk. That's the important part of breastfeeding. Then it's your diet and lifestyle, right? Well, right now, 1 out of every 3 kids are born by C section. When you're a C section, you go straight out of the belly into the nurse's gloves. They've done those kind of microbiome tests that you're talking about on babies that were born by C section, and they find the same bacteria that was on the nurse's gloves growing in the baby's gut. And that's how 1 out of every 3 people are starting their lives. So I really like the analogy of your microbiome is like your own garden. So what that means is the probiotics are the plants of your garden, and fiber is the fertilizer of your garden. And what can happen in a garden when you don't take care of it is weeds can grow. And that is called dysbiosis. So that's what a good stool test should be testing for. Do you have dysbiosis, or otherwise to me known as weeds overgrowing your garden? Do you have bad bacteria? Do you have candida? Do you have parasites? Do you have viruses? So we can test for all these negative things that are overgrowing your microbiome. What's the best way for that to happen? Take 1 course of antibiotics. And how many people do you know that have never been on antibiotics? What are antibiotics? They're tablets that were designed to kill bacteria. Where do you put them? In a tube that has 5 pounds of bacteria in it. So, what happens if you went into your garden and sprayed it with a bunch of Roundup and killed off half the plants? Weeds are going to start growing. That's the same thing that happens in our guts. And for most people, you won't get symptoms. That's another problem. You won't get symptoms right away from having
Yeah.
dysbiosis. It'll present
Okay.
as some kind of disease down the road. And so that's the benefit of doing a microbiome test, is to get ahead of the game.
Got it. So a microbiome test, what we're looking for is the ratio of good bacteria to bad bacteria.
Yeah.
Does that sound simple enough?
Yes.
Okay. So let's say we have a lot of bad bacteria in our gut, and we do this gut health test. Zach, you got a ton of bad bacteria. What should you do differently?
I would kill off the bacteria. So I would put you on an herbal regimen. So you want to use something that kills off the bacteria, because just diet or probiotics isn't going to work. That's like, the equivalent of if your garden at home was full of weeds, you don't go to the nursery and buy more plants. You have to pull the weeds out. So when it comes to things that kill bacteria, there are things like garlic, berberine, oregano oil, uva ursi, silver. There's a lot of companies that make blends that are called antimicrobial blends. One of the most known ones is called biocidin. So these are basically like natural antibiotics, right? That they're going to kill off the weeds. They're probably going to kill off some of the good bacteria, but that's okay. Once you have a stool test and you know what you're working with, sometimes you need to kill off that stuff to be able to regrow a new microbiome.
Okay.
So
So an herbal diet. Now this herbal diet with garlic and all these other things you just mentioned, am I only eating the garlic and everything you mentioned for 24 hours, 48 hours for a week?
So
Tell me a little bit what that looks like.
I actually use it in capsules. So I will use supplements that is high dose garlic, or is high dose berberine, or grapefruit seed extract, or silver, or whatever. So I will use herbs in capsules, because you'd have to eat a ton of garlic. So I would typically have you on an herbal regimen for 2 months, and then I would do the stool test over to make sure that whatever we were treating is gone. And then you focus on
Okay.
diet, and it's eating lots of fermented foods, um, sauerkraut, kimchi, kombucha
Kombucha.
that's not high in sugar, yogurts, so you focus on diet once you rebalance whatever's gone wrong in your microbiome.
Amazing. It's funny because as time goes on and I interview people on my podcast, whether it's fasting or whether it's a nutritionist or a gut health specialist, toxin specialist, I learn so much and I always question like what am I doing right? What am I doing wrong? And then I came to the conclusion that I really want to detox myself from everything. Like stop taking my omega-3s, stop taking magnesium. I don't want to even drink protein powder and I just want to eat a diet that's high in protein, high in fat, some carbohydrates, and then restart and figure out what's working and not what's not working. Because omega-3s are good for my skin and my brain health and my joints and stuff, right? But do I see the difference? Absolutely not.
Yeah.
Magnesium is great for a lot of things, and I take it every single night. I believe in it, and I'm sure you do as well, but I don't see the difference. But I want to be able to see the difference. So do you have any advice for me as to how I can just create a baseline of like no supplements, eating a clean diet, and then slowly integrate the omega-3, slowly integrate the magnesium, protein powder, XYZ?
So I would give yourself a 3-month break, because if there is anything that you're reacting to, like for example, a food sensitivity, it would take about 3 months for that stuff to get cleared out of your system, and then I would start introducing it. But the funny thing is that most people think when they come to me that I'm going to put them on a bunch of supplements. It's actually the opposite. I'm frequently getting people off of supplements. I have people that'll come to me. I had one person that showed up to my office with 2 suitcases full of supplements. And as for me, I'm like, let's just stop all of it.
All of
Yeah.
them. All of them.
So I like to do, if you want to do testing, I would do your testing of your microbiome, of your heavy metals, clean that stuff out, and then just focus on your diet, sleep, exercise. I don't think we need supplements. I think we can use them as needed. So if you're traveling and your diet sucks, you need a multivitamin and maybe a probiotic, sure. But I think what we should be doing is just focusing on our diet, getting good sleep, getting exercise,
Yep.
working on our
Love that
mental
answer.
health. And you don't need all that
Mm-hmm.
extra stuff, because just relying on supplements, I mean, that's basically like a traditional medicine approach, just using something more
Right.
natural.
Which clearly doesn't work because they're getting rich as hell by treating us year after year
Right.
for 50 years in a row. So let me ask you this question. What does your typical week look like when it comes to your diet? What's a common meal that you eat? Do you fast? Do you drink tea at night? Tell me a little bit about that and what's the most important thing for you when it comes to your diet and nutrition?
So for me, the most important thing, and I get thoroughly into it in my first book, Unfunk Your Gut, is an elimination diet. So that is to identify food sensitivities. Those are kind of what I call the silent killers. And because when you're sensitive to a food, you won't really know it. So I do an elimination diet once a year. And because food sensitivities can change. And besides that, the one diet goal that I give people that I try to follow is eat 9 to 12 servings of vegetables and fruit a day. That's basically 3 servings for breakfast, lunch, and dinner. If you go through your standard American diet, people are eating about 1, right? So when you're eating that many fruits and vegetables, there's not room for all the other junk, right? Because you're full. You're eating all these carrots or
Yeah.
broccoli or peaches and cherries, etc., right? So you're kind of full. I if people check out my first book or the second book, they'll know that to me the most important part of health is mental, emotional, spiritual health. And so what I see people get too stressed over their diet, right? Like one year they're carnivore, the next year they're vegan, the next year they're paleo, and it's like they're constantly stressing over it. Do what makes you feel good. Don't, do an elimination diet. Focus, if you're going to eat meat or fish, focus on animals that themselves have been fed well, right? So cows that are not locked up in pens, but cows that are roaming around in a grass field, right? Fish that are not being farmed in Costa Rica, but fish that are out swimming in the ocean. So animals that have been treated themselves well. And then
Right.
an elimination diet, food sensitivities, and I do really love intermittent fasting, not just for weight
Yeah.
loss like most people are doing it, but for hormone health. I recommend 24 hours twice to 3 times a week. So when I'm in my good flow, that's what I'm doing.
Okay. Can you go into a little bit of detail about an elimination diet?
Yes.
What is an elimination diet?
It is a test to diagnose food sensitivities. So when somebody reacts to a food, you can have an allergy, you can have celiac disease, or you could be sensitive. Allergies and celiac are really easy because your regular doctor could do a blood test and diagnose you. Sensitivities are a problem because the reaction is delayed hours to days after eating the food. So I could eat a bagel every day for breakfast and I feel fine, but I get chronic migraines or I get chronic gut issues or I have eczema and I go to the doctor and I get pills for that, and I keep eating the bagel and I have no clue, right? And so I
Right.
just get more and more pills and I'm a great customer for them. An elimination diet, everything in your body has a half-life. So that's your hormones, alcohol, if you smoke marijuana, prescription medications. That's why some are taken once a day, some are once a month, some are 4 times a day. So everything has a different clearance time. If your body is sensitive to a food, it creates IgG antibodies. Those antibodies have a half-life of 21 days. So what that means is, let's say I had a bagel today for breakfast and I have 100 antibodies floating around and I got depression and I have no clue it's the bagel. If I completely avoid gluten for 21 days, my immune response, the antibodies will cut in half to 50. On day 22, I will reintroduce the gluten. If my body remembers it, it will attack and create symptoms. So I use a tracking journal. And so systematically, you go through food by food and identify which foods you're reacting to. In my book, I have a whole chapter on the elimination diet, along with 50 plus recipes that a
Amazing.
patient of mine who's a chef, she wrote them for me. So there's a lot of tools, but an elimination diet, if someone's trying to get right and they don't want to see a functional medicine doctor, they want to start on their own, I would 100% recommend starting with that. And it's a step-by-step
Great.
process to make sure you don't have a sensitivity to soy or dairy or corn or beef or pork or whatever.
Amazing. Thank you so much,
Yeah.
Doctor. All the people that are listening on Spotify or Apple Podcasts, if you're listening on Audible, I'm going to put all of Dr. Kozlowski's information, link to his book below in the description. If you're watching on YouTube, thank you so much for sticking around to the end. Below is a link to all of Dr. Kozlowski's resources. Thank you so much.
Yeah.
Have a wonderful day.
Thank you.
And I look forward to connecting again soon.
Likewise.
What's up, guys? I want to thank you so much for listening to the podcast. We have hundreds of weekly listeners, and I wanted to make sure that everyone listening is hyper aware of how I can serve them best. So if you're interested in hiring me as your life coach or hiring me as your nutritionist, or maybe you just want to get some free advice, head over to lifecoachzach.com, book a free 30-minute consultation, serious inquiries only, and I would love to ask you serious, open-ended, powerful questions that are going to help you pivot your life in a better direction. Let's co-create an action plan and really step in to the greatest version of ourselves.